So as the government works to ramp up vaccine production, several states are easing their coronavirus restrictions, but the CDC warns not so fast.
Now is not the time to relax the critical safeguards that we know can stop the spread of COVID-19 in our communities.
Texas Republican Governor Greg Abbott announced yesterday that he is lifting the state's mask mandate and allowing all businesses to fully open next week. So I want to bring in Dr. Neeta Ogden. She is an internal medicine specialist and immunologist. Thanks for joining us. Now, it's not just, what's happening in Texas, but we're seeing other places opening up. And I think opening up sort of incrementally is what we expect, just not sort of this kind of free-for-all that the governor is doing. And I should say he's talking about the state mask mandate. So individual towns, individual counties, they may decide on, to take different measures for their areas, but you do not have the might of the state requiring people to wear those masks. Governor Abbott is lifting these orders when less than 7% of the state of Texas has actually been inoculated. I want to talk to you about, your concerns, but before that, I want to play a little bit from his press conference yesterday.
Now, despite these changes, remember this: removing state mandates does not end personal responsibility or the importance of caring for your family members and caring for your friends and caring for others in your community. Personal vigilance to follow the safe standards is still needed to contain COVID. It's just that now state mandates are no longer needed.
So Mississippi also announced a similar move. Dr. Ogden, you heard the governor there sort of leaning into personal responsibility. What's your take on this? Do you think that after a year of hearing what is the right thing to do, that people will, continue to wear masks and continue to social distance if they do not have the backing of the state? Or do you anticipate to see a rise in cases in these areas?
Good morning. I think this is wildly premature, frankly. We know that there are more transmissible variants in the United States that have proliferated very quickly in other parts of the world, and it's simply not the time to relax these measures. Yes, we are on the cusp of a change with the coronavirus. That kind of end is in sight, but it's still too early. I mean, we just heard Rochelle Walensky in your opening segment talk about how dangerous it is to start taking these moves to open up. We're just not there yet. I just find that the CDC, which is backed by science and data, says X, and then some of these states do Y. And I found the governor's statement to be a little ambiguous. Why not just come out and say, continue to socially distance? Now they're not requiring masks, but talk about the variants that we're going to be dealing with and that the risk that's there. We just simply don't know. We do know that we know how the coronavirus operates and how these variants operate in unvaccinated communities, and a large part of this country is still not vaccinated, as you said about Texas specifically. The coronavirus loves that. It is easily infecting people and transmits very easily, especially these variants. We don't know how that will play out. We do know actually that in these other countries that people who had, like in Brazil, coronavirus did get reinfected, especially those who had a mild illness, especially in April 2020. So this is super concerning, and I think it's a little too early for them to be taking away these mandates, and they need to be really clear about what's still going on with the coronavirus rather than just vaguely talking about personal responsibility. I think things need to be spelled out better.
Yeah, I mean, the reality, Doctor, is, if you just imagine movie theaters and nightclubs and bars and sporting events, the number of people that will now flock and cram themselves into these locations, and with these variants that are rapidly infecting more people. I mean, here in New York City, there's a real concern in this state because already in the Bronx, we've seen a high percentage of people with this new, I think it's the B125, right, variant that is now being discussed. They've seen a rapid increase in the number of people being infected with that. And so, you know, it's a very risky move, and something that I don't think hit enough, which is that Texas and Mississippi are two of the states that have the least number of people vaccinated in the entire country. I mean, I don't know the exact number, but they're not, you know, they're not achieving the levels that some of the other states are achieving. So it's a real concern. Meanwhile, Dr. Ogden,
and Vlad,
sorry, go ahead, Emery.
Sorry, Vlad. I just wanted to sort of piggyback that on that point that we're seeing a dip in numbers, but the numbers are still terrible.
So I know.
Particularly when you look around the world, if you were to compare Texas to maybe another country with a similar population like Malaysia, Texas looks terrible compared to Malaysia. So there's still a lot that needs to be done to be in sort of a safe zone. And I think people forget that just because they see some numbers go down. Sorry, doctor.
No, I totally agree with you. I think this is really worrisome, and I really hope that we see people just continue to practice, mask wearing on their own, and that they know that we're not out of the woods, and that we're just still on the precipice of these variants and how they behave, which are really, really scary and dangerous.
Meanwhile, Doctor, President Biden announced that Johnson & Johnson is now going to work with Merck, which is a direct competitor, to make more vaccine doses quicker. I want to play a clip of this announcement.
When we came into office, the prior administration had contracted for not nearly enough vaccine to cover adults in America. We rectified that. And I'm pleased to announce today, as a consequence of the stepped-up process that I've ordered and just outlined, this country will have enough vaccine supply, I'll say it again, for every adult in America by the end of May.
So the president originally said we'd have these doses by July. 2 months is a big difference, but even though we'll have enough for every adult in the U.S. by then, how much longer will it take for us to get back to some level of normalcy?
Well, Biden actually spoke to that and said by this time next year, or I guess I would be by this time 2022. And that seems later than what he had once said before with Christmas. I think that we're looking at, well into 2021, just because, yes, there will be vaccines available, but we really need to address getting people to access the vaccine and actually take it. There is still a lot of vaccine hesitancy. A third of Americans still say that they won't get the vaccine. I have a lot of people who I see in my office who are still worried about getting the vaccine. And they talk about things like, oh, I heard this happen to, side effects after the vaccine. So I think a lot of education still needs to happen about the vaccine, that side effects are normal, that it's safer to get the vaccine than to get COVID, frankly. And when I educate my patients a lot about long COVID and how it's fairly miserable. And so there needs to be still a lot of outreach. We're putting so much effort into getting the vaccines in a timely fashion. Well, we need to really take it one step further about getting it into people's arms and making them to agree to take it so that we can then finally achieve that herd immunity and see normalcy.
Dr. Neeta Ogden, always great to have you. Thank you very much.
Thanks for having me.